Hello, dear colleagues, how are you? My name is Berdikhojayev. My assistant Sheikh Mohammed Khan, and this is a national hospital of the Presidential Affairs Administration Medical Center in Republic of Kazakhstan in Almaty city. And now we have a patient with the meningioma in parietal territory with the involvement of sagittal sinus with compression and partially grow inside the sinus, and you can see it's enhanced with contrast. It's enhanced with contrast and yes, patient is 100 something kilos, 150 kilos with severe obesity, and the height is nearly 150 centimeter. It's a very compact lady with just 150 kilogram of happiness. Yeah? Yes, body mass is quite high, and 55. Yes, it's obesity. Okay, now we can see the territory of right MCA, and on the left ICA territory there is a paraclinoid aneurysm. For me, it's look like intradural. It's not paraclinic, it's look like ophthalmic territory, just after ophthalmic. And I think the headache is from this point. She has a headache, huh? And also the meningioma may cause the headaches, and patient under local, and we're deciding how to treat her. There is a problem with the general anesthesia because of obesity. It's possible, but the intubation process might be complicated. That's why we suggested to start under local. You can see the meningioma, and the meningeal artery is going to that territory. Okay, let's see. Let's start. My assistant Mohammed Khan Shurikhanullah. We have two guest doctors, one from Kizlarda city, Sambattım, and the second doctor from Tajikistan, Kamiljon Abdusamadov. Operating nurse is Madina. Video support presented by Evgeny Grishayev from Videon company, and the anesthesiology team, anesthesiologist and anesthesiology nurse is Baht. Anesthesiolog ne adı neydi? Anesthesiolog. Doktor. Şeyh Mehmet. Benim перчаткам yok sonra. Yes, patient is coughing. Еще и кашляет, да? Ну, сейчас кашляет же. Хорошо. Проблема была, да? Супрастин бере салсаңшы? Allergopres не бар. Соны бере берсін. Okay, Sheikh Ahmed is placed the guiding in external carotid territory on the right side. Yes, we are planning to treat both pathologies. The first of all, we will go to the territory of lidocaine. We will take a lidocaine 2% 2% for cc. And then, yes, first of all, we'll deal with the meningioma. And after meningioma, we'll go for the territory of it was a little bit spasm. It was a territory external carotid. Yes, after embolization of the meningioma, we will continue with the aneurysm. Might be better to place stent, but it's look like secular aneurysm, and we can do first session just simple coiling. Так, Х217 просто дайындап қоя салыңыз. Чекай блок дайындап қоя салыңыз, пока ашпай тұра тұрыңыз. Так, и эклипс. Однопросветный эклипс дайындап қоя саласыз ғой. Тамағыңызға бірдеме түсіп кетті ма? Сізде сондай болушы ма еді? Иногда болады. Қорқпай жата беріңіз, қазір аллергияның дәрісін салады, обезболивающий жасап қойды. Представь, если мы еще заинтубировали, она кашляет. Жоқ, енді басылайын деп отыр. Сіздің басыңызда тағы бір ауру бар. Аневризма деген ауру бар. Менингиома деген ауруды көрдік, еще аневризма деген ауруымыз бар. Екеуі де баста ауыртатын аурулар. Аневризма қауіпті ек, вот здесь. I think it would be complicated to treat this patient, huh? With coughing. Just jump hook this. What is it? Дексаметазон 8 мг салсасыншы. Вам воды нельзя. Жолсаңыз. Шкейін жоқ өтірейін. Жоқ, келем. Контраст аллергия ұқсамайды. Жауысыңыз. Ана стерильдің астына жауысыңыз. Сальбутамол сияқты еш нәрсе жоқ па? Эуфилин бар ма, эуфилин? Эуфилин жасай салсаңызшы, бір 5 кубик. Врачтан сұрайсаңызшы. Жоқ, наоборот, кашель тоқтайды. Сіз ауырып келгенсіз ба? Вообще, по конституции похоже на астматик.
Вообще есть такое, но
Вам нужно будет полежать, не кашлять, хорошо? Экранды бір 10 сантиметр аяғына қарай тарта салыңыздаршы. Вот. Мы же не сможем так оперировать. Мы не сможем так оперировать. У вас очень серьезный кашель, а? Не разговаривайте, пожалуйста. Стоп. Смарт-мозг. Алдында картинканы экранға қоясыңшы, референция. Рыжих, менингей көрдік жүр. Чтобы я хотя бы по картинке ориентировался. Okay, let's do the Andrew first, and then we can decide. Абсцисс. Так. Дем саженок поясаш? Демесу. Yes, we can see the meningioma. It's a little bit down. I have seen the photos of Vladimir Kalushik, my friend from Croatia. He also received the zero gravity system, and I hope he will be happy with this system. Так, назад. Стоп. Медленно. Вперед. Вперед. Вперед. Вперед. Назад, назад, назад. Назад. Окей, вперед. Стоп. Услахивайся. Смарт-мозг. Проводник перестал. Проводник перестал. Проводник ты перестал. Давление учить нәрсес жыртылып кетпесін. Давлениесі қай жағынан өлшеп отыр? Біздің гемодинамика ма, анау ма? Ана жақтан өлшесе, біздікін өлшей салсын, өйткені мынау жанып кетеді қазір. Мадина, мынаны өлшей салшы. Мынаның кнопкасынан өлшей салшы, гемодинамиканы. Ага, все. Не істедің? Смарт маска жақсы тұрады ғой. Предыдущий ангиография. Ага, стоп. Осылай. The branch is quite small, huh? And it's in the wedge position now. Okay. Let's check the angle. Қозғалмаңыз. Қозғалмаңыз. Yes, it's supplying the territory of meningioma. Назад. Назад, назад, назад. It's quite small artery, huh? Назад. Назад. Сәл нематоп бересіз бе? Мадина, нематоп. 20-ка 2 кубик жинай салыңыздар. Yes, this artery is reaching the territory of meningioma. Жиырмаға араластырып жібере сал. 20-ға дейін араластырып жібере сал. Так, бере сал. I will give a little bit nimodipine. But first of all, I will give couple cc of lidocaine. Қазір басылады ауырған. As it said, 2 cc. Maybe we need to take something like a Sonic, huh? Sonic 1.2, maybe. Let's see. Now we gave 3 cc of diluted nimodipine. We took 2 cc and diluted till 20. And now I am injecting the second portion, this another 3 cc. In total 6 cc of nimodipine. Okay. Maybe we need something like a Chikai Black, huh? Maybe we'll ask for Chikai Black to push the catheter distally. or it might be better to take a Sonic 1.2. Okay, let's take Sonic. Суға саласың. Sonic 1.2 деген бар ма? Один. Бerdikhojayev. Ага, біреу ғой, да? Бере салыңыз. Так, сыртын көрсетесіз ба? Так, бұл гибридпен жүреді ғой, да? Бізде гибрид семерка жоқ, да? Чекай, восьмерка ашып бере салыңызшы. Восьмерка. Екеуін ашып бере салыңыз. Бере беріңіз. I hope it will work with the Chikai 8, but the recommended guide wire is so. Катетерді ашып берсеңіз, Соникті. Yeah, there is a plan B. If it will not work with the Chikai 8, then we can go to the left side. We can go for the left side, huh? Let's see. Так, предыдущий ангел неге қоясыз, референтке. It looks like it will work. Назад. Я, скорее всего, смарт-маск қоясың. Назад. Осылай смарт-маск. Жоқ, смарт-маск. Okay. Okay, let's see what we can do. Что? Поясница сейчас обезболит. Надо было грыжу прооперировать вначале, да? Шейх Мишахович, надо было грыжу прооперировать для начала. У него грыжа прооперирована? She were operated on the disc herniation, да? Блин, я не вижу. Инструмент свой не вижу. Правильно идет, да? Так, зум бересешь? Стоп, стоп, стоп, стоп. Грыжаны жасап опқылта болдым. Туда, не туда. Как зум? Жоқ. Алдындағы бір ангиосын қойып жүр. Бір жақсы көрінген. Yes, it should go up and then down. But now we are in a wedge position. It's fixed as much as possible. It's as much as possible. Okay. The diameter of the artery is quite small. Okay, we try to push as much as possible. It's nearly 3 centimeters distally than previous headway duo. I hope it will work. I hope it will work. It looks like there is another branch coming from down. There is a branch coming from down part. Which one is this? Ең басындағы наружкадан түсірген көрсетші. Стоп. Меньше, меньше. Вперед, назад. Yes, it might be this branch. It might be this branch. Biz qay веткада turibmiz? Жоғарыда. Okay, let's go for this branch. Yes, here's another branch. This is more straight one. We're trying to go from the contralateral side, from the right side, because the left side even tinier. Huh? There's the link side is more tinier, and the CK8 is quite experienced stress. Huh? It's damaged. It's look like mirage wire. The oldest generation knows how the mirage wire looks like. Роднов қойсаш один раз назад. and the shape of the chikai. It looked like a mirage, marathon and mirage. Yeah? I'm a little bit older, that's why I know those old devices. Yes, we need to go to this bridge, and I hope it will work. It's not rotating. Maybe we need to just push the micro. Let's go up. Тағы бір чекай восьмерку бересіңізші? It's not working. Чекай восьмерка. Біреуін бересіңіз. Okay. Yes. This looks like kaput. Пока шпайтер тұрыңыз. Нені бересің? Көтен жағынан кигізесің. Okay, let's try to reshape it. Если после операции начнется пневмония, бронхит, это будет очень тяжело, поэтому лучше подместное сделать. I think the decision to treat under local anesthesia is quite better because she was coughing, but now she's experiencing back pain, and Sheikh Ahmed already made a discectomy in lumbar spine, but I think it was not so effective. Huh? It might be effective for the legs, but it wasn't effective for the back. It's not all the time effective. She could walk, but now she could walk, but she couldn't lie on the spine, huh? On the back. Yes, the treatment should involve also the patient, not only the physician. She need to lose some weight. She need to work on obesity also. It's not going. Okay, let's give me new one. Новый бересің. Okay, we will take new CK8. CK бересің, лақ бересің. Okay, I will show you the tip of the Shikai. It became like this. That's why it's not working. 0,8. Today I have an assistant microsurgeon. Yes, Sheikh Ahmed is microsurgeon and microsurgical assistants. It's a little bit different than endovascular. Huh? It's totally different and difficult. Difficult for the operator, different for the assistant. But it's part of life, yes. Different for the assistant. It's a different surgery, yeah? It's not forceps and scissors. It's some wires and okay. I'm just joking. Because of the flow of the patients in the department, we can divide special surgeons for the microsurgery, and we can also prepare part of the surgeons for the endovascular. It's our как будет преимущество? Advantages, yeah. Now I think it's in the wedge position. Да? Как выглядит последний снимок? Самый последний снимок. Ага, назад, назад, назад. После этого, следующий. Next one. Вперед, вперед. Stop. Also. Okay, it's going a little bit down and then it goes up. I think now it's enough. It goes down and then it goes up. Okay. Okay, it's in the wedge position. Басыңыз ауырған кезде беліңіздің ауырғаны азайып қалып жатыр ма? Қоймай жатыр? Қазір қояды. Қазір тағы да дәрі жібереміз, сосын басылып қалады. Жақсылап операцияға дайындаған кезде блокада жасап бермейсің ме? Yes, this is a network of the meningioma. Stop. Yes, it's better if we can go there. There is a branch coming from the left side. Okay. Осыны референтке ана жаққа тастай сал. Давай. Lidocaine. Okay, we'll inject a little bit lidocaine. Чуть-чуть фентанил берілсе.
Фентанил.
Сұрап көрсінші, фентанил бере алады ма екен? Okay. Дем су бере сал. И сквит уника. Окей. Ну, чуть-чуть надо будет потерпеть. У вас еще аневризма, мы думаем аневризму тоже за один раз сделать, чтобы вы не мучились еще. Хорошо? Потерпите? Сейчас мы сделаем сильный препарат, фентанил называется. Okay, let's compare what we have from the links, from the left side. Тамыр бар екен, но мынаған түсіп, мына жерге келеді. Those two branches. I think it's this one. We should go there. Okay, let's go first from here. It will be occluded partially, then we can go from this side. Okay. Сейчас надо будет потерпеть, хорошо? Терпеть надо будет. Боль будет, как будто в пояснице боль. Потерпите. Не шевелимся. Следим за рефлюксом. Шейх Mynzhylky, следим за рефлексом. Okay, it goes to the collaterals. It goes outside. Да, глю қойсаш. Глю. It's extravasating, I think. Oh, it's look like it's inside the bony structures. В кости. Okay. It's not going, huh? Okay. From this side we can finish. It couldn't penetrate so much because пока хипесал килишановымыз. We will go to the left side. Yes, we gave a little bit fentanyl, and because of the back pain and the pain in the brain part, it's okay. Yes. There is some. That's better. Пока headway дуонышный траксес салып қойсаш. Родмап тапсайсың. Родмап тапсайсың. Алшын өйді. И навигейт қойсың. Родмап басасың. И навигейт. Алып тастайсың. I think it's inside the external. It's like we're inside the external carotid. Так, были. Шейх Mynzhylky, проводниктерін были. Так, стоп. Оставь. Смарт-мозг. Так, ну не, чекаю. Стоп. Вперед. Стоп. Обычная иголка. Оған ол торкер емес. Он торкер бөлек қой. Сол. Кешімсі. Назад. Чуть-чуть назад. Чуть-чуть назад. Все. Нені бересеш? Смарт-маска. Все, стоп. На картинканы мында қоясыз. И на картинка, ну, следующий шаг, так, который... Okay. Now we are in the correct territory. Так, стоп, вперед, назад. Так, вперед, стоп. Так, вот эта ветка, которая вверх пошла. This one is this one, huh? Is it this one? Okay, this one. Okay. Now we're in the branch. So, stop. Hangi grafiğini koyasır? Предыдущий. Ага. Стоп, назад, один раз. Так. Мынау қай жерге дейін барады екен? Ана кішірейте салшы. Кішірейте сал. 0,20 сал. Окей. I think this is a branch for meningioma. Berdikhojayev ne sal? Turtkuluk. Kaz. Так, и даем сочинение колесо. Даем сочинение. Oh, this is a branch of the meningioma, and it's in the wedge position. Okay, it's a good position. Huh? Give me lidocaine. In this case, we will give a little bit more than we are giving usually. Because of the weight, it's a twice or triple than the regular patient. Yeah, Geneva. Okay. Okay. And geographically, this site was more tiny than the right side. That's why we glue. Okay. İlk radyasyon koysam. Radyasyon ilk koysam. Okay, we increased a little bit the amount of radiation. And as you can see, it's crossing the midline. And now we start injecting, and it's a good penetration. Also the collaterals, also the right side. I think it's good. Okay, it's outside. Yeah. Назад. Smart mask. I think now we included all feeding branches, but it's need a little bit more. It could be some branches coming from the vertebral-basilar system. But from the outside, the soft tissue branches is already included. The control MR will be planned in next 2 days. And usually, yes, now we disconnected the branches coming from the down part. It's very important. Сейчас потерпите, каз бітіреміз қазір. Шыдай тұрыңыз. Yes, it's going quite down. That's why we need to control also the part coming from the posterior meningeal. Okay. Қазір басылады. Басыңыз қимылдатпаңыз. Басыңыз қимылдатпаңыз. Жарайды ма? Қазір басылады. Yes. I think now we can finish. We included all collateral branches. We included the feeding branches. Қимылдамаңыз. Қазір бітіреміз қазір. Қазір таза опухоль жасалып отыр. Okay, it's connected from the posterior part. These look like collaterals. Now I think we can stop. We can finish. Все. Все, теперь не будет больно. Yeah, just this. Yes, we finished with the meningioma. Опухоль полностью закрыли, можете расслабиться. Теперь больно не будет. Сейчас один контраст будет, в голове чуть-чуть вкус металла. Все хорошо. Вы молодец. Вы молодец. Хорошо. Сейчас будем делать аневризму и на этом закончим. Yes, it's a grade 1 meningioma, and patient has good collateral circulation. That's why we can use this angiography and I will ask to give me headway 17. Headway 17 и Eclipse однопросветный аж пересосан. Да. Navigate. Радиацион кішірейте сол. И Smart Mask пересол. I think there is a spasm. Headway'дің басын 45-90 градуспен бұру керек болады, кончигін 6 мм. Мен дайындап берейін, сен пока Eclipse ашты бер. Eclipse двухпросветный. Чекай Black Touch пересонс.
Ой, ё-моё.
Ладно, ничего страшного. Естественно. Фен дроссесонс. Yes, it was a good comment from Rajiv Shivashankar. We had a podcast on the channel for the colleagues, English-speaking colleagues. The topic was on giant aneurysms, and Rajiv said they stopped to use a heat gun because of the hydrophilic cover damage, but we are working for 12, I think now it's 12 years we are working with the heat gun. And usually it's okay. Okay. For the navigation of headway 17, in my experience, I prefer to use Chikai Black. It's more predictable. И тағы бір ой коннектор ашып бере салыңыз. Иша Ахмет Шөрхан протоколда жазсын 4 Y коннектор қолдандық деп. Yes, it was a audit from the hospital administration, and they asking to feel how many Y connectors we used during the case. For the administration, it's quite interesting.
Ой, коннектор аш пересонс.
And then I think for physician it could be interesting where is the money. Yeah? If the administration is interesting, where is the devices, and then we can ask where is the money. I'm just joking, but it's a part of life. Huh? We also may ask. Why connector budgeted? Yes, the balloon is patent. A little bit air bubble. I will just put inside the water. It was a 3 cc of contrast and 2 cc of saline. 60% of contrast. It's very easy. Оған нені саласын, блэкті саласын. Бүйтіп қойасың. Все салар. Yes. And Traxxas we will use for Eclipse double lumen. Yes. It's a little bit confusing when you have a single lumen, when you have a double lumen, and when you have a everyday new nurse, new team of anesthesiology is coming twice a day, and microsurgical assistant is also something new. Yeah? everything is new during the day. Yes, it's part of life. Nothing constant, huh? Nothing constant. Life is not constant, huh? Life is changing every minute. Life is changing every minute, yes. For the European and the US part, I think now it's a holidays, huh? It's a Christmas holidays, next couple of weeks. And we are working like a crazy because the government and the insurance system gave us additional quotation, and we can do cases. Thank you, insurance system. Thank you, insurance system. Жыл бойы жұмыс істемей, көтің жыртылып. We are just joking. It's a literary words. Nothing bad. Ешнәрсе жаман айтқан жоқпыз ғой. Декабрьдің 25-інде жыл бойы күткен. Some of the patients is waiting on the waiting list till waiting list came from June. The quotation was finished, the instruments were finished, everything were finished. Everything were finished. Okay. It's a little bit spasm. Okay, now I think it's better. Yes, surprisingly, on my shelf now, I have only one cigarette stand and only one Casper stand, which is unusual. Unusual for presidential hospital. There is a kink. Жылспа. Екінші проводник өтпей қалады. Енді болады. Okay. Let's do angiography. I think it's a spasm. We have nimodipine. We will give another 5 cc of nimodipine. Okay, it's a good chance to show how to check the zoom the breath abscesses. What I learned from René, when you prepare the balloon, then you need to inflate it in extracranial circulation, then it's a quite safe condition to check the patency of the balloon. And yes, then you can say your balloon is ready. This is angioplasty. This is angioplasty. It's a regular angioplasty, looks like this. And here we can also angioplast. Yes, it's bulky. Huh? Okay. Now we made angioplasty and we can say the balloon is ready. Okay. I think the Chicai black is already inside the aneurysm. Stop. Stop. Yes, it's a Chicaya black inside the aneurysm. This is Traxis, and this is we crossed the. Now we can leave it here. We can work under local anesthesia because of the cross flow. Yeah? Patient has a good collaterals, that's why it's possible to go under local. Now the catheter is inside the aneurysm, and we need to fix it with the balloon inflation, and it's very important to pull a little bit the balloon because balloon is trying to go forward. Okay. Yes, now we can leave the balloon here, and we can retrieve the Chicay. Спираль 4 деген қайсы бар? Мадина? Спираль 4. Төртте 8 бере салыңыз оптима. 4-те 8 и дайындайсыз 3-те 10, 3-те 8, 3-те 8. Okay. The first coil will be optima 4/8 and the second coil will be optima 3/8. Kamil John is asking, is it necessary to do 3D? It's possible, but I think it's nicely the working projection. We can see the. Мы можем увидеть купол, мы можем увидеть шейку. Yes, I'm quite old and like a dinosaur. That's why I can work in on 2D. But the new generation usually may ask for 3D because of the practice. Okay. I'm not so satisfied with the coil. Yes, for this reason usually I prefer for the first coil Axiom 3D, but because these kind of coils are quite soft. Delete. Екіде сосын 2-де 4 ашасыз ғой. 2-де 6, 2-де 4 не бар? Аша беріңіз. 3-те 8. 3-те 8 аша беріңіз. 2-де 6 бересіз содан кейін. We can keep the balloon without deflation because of the good collateral, good ACOM. And вперед. Екіні алып ер. It's a 3/8, the same complex coil from Balt. It's Optima. And we'll place as much as possible. Usually the next coil is fixing the previous coil. Нужно, чтобы все спирали прихватились и плотно легли. Так, бір жарымда 3. The first was 4/8, the second is 3/8, the third is 2/6. All of them is optima. This is 2/6. It's went outside. Thanks to anatomy, we can a little bit push the micro. Bir жарым, үш. Bir жарым, үш, bir жарым, үштен екеу көресіз ғой. Фентанилдан кейін ұйықтап қалды ғой деймін. Фентанилдан кейін ұйықтап қалды ғой деймін. Yes, it looks like patient is sleeping. Жоқ, ұйықтап атқан жоқ. Көстен. Ау! Просто не сорта дейді. Аузына түсіп кетті. Okay, let's place one more Optima 1.5/3. Later. Let's take it out. Small tail. I think it's okay. Yes, we placed as much as possible. It's mandatory. Yes. The balloon is deflated, huh? Why? Balloon сдулся. Okay, during the angiography, it's very important to give not so big force, huh? It's very important. Yes, good. We can say the coil loop at the wall of the artery is good. ACOM is in place, ophthalmic artery is in place. We can give roadmap. And it's possible to take out the balloon. It's a so-called hijama. We need to take out a little bit part of the blood. Okay, we took it out. Okay, wetting out. It was no heparin and it was no any kind of disaggregant administration. We are in the external carotid. Okay, just a second. Yes, aneurysm is occluded, meningioma is occluded, and the MCA territory is clear. Huh? Feel it? Yes, it's clear. I will ask Sheikh Ahmed to do control CT. Келес пациент, келес. Внутренние сонные до аневризма, подместные. Келес подместные. Сенковый, да, тоже? Белесный. Okay. Okay, let's wait for the control CT. Подъем. Okay. Now expert CT is on the way. We had a short discussion with Kamil John and Sambatam about the coil sizing. Yes, which kind of coil should be first? Which is the criteria of decreasing the size? Yes, this is meningioma. The brain is clear. There is no complication. The aneurysm is occluded. There is artifact from the coils. Now we can finish the case, and the next case is ICA aneurysm. It's smaller than this aneurysm, but with the diverticulum. And see you in next 20 minutes. Next case also under local anesthesia.